Hello, Dr. Chaitanya.
Yes, ma'am.
Heartiest congratulations on passing your DNB practical exam with such an excellent score.
Thank you, ma'am. Thank you, ma'am. It's very glad and a very pleasure to meet you, one of my idol, that is you, ma'am. And you are the greatest teacher I have seen, one of the greatest. And your teachings are like, it's a storytelling, ma'am, like not teachings. You are infusing that into our brains and let us, we can explain to others also. That is very good.
Thank you so much. I should be the one praising you. You're doing the other way around.
No, ma'am. It's
But
like I'm very excited to meet you, ma'am. Whenever I am listening to classes, I thought like the depth of the knowledge you have and the teaching way, the way of the teaching, that is very admirable, ma'am.
thank you so much. And I would like to congratulate you from the bottom of my heart. DNB Practical is not an easy exam to pass, and you have done exceedingly well. So, can you give us a little bit of an overview of how did you prepare for your practical? How much time did you have, and what are the resources you used?
The only resource I use in eConceptual only and plus Tata Memorial book, ma'am. Not
Okay,
any other
art.
book. Yes, ma'am.
Hmm.
Actually, the whenever I got the theory result, August 15th, we got it.
Hmm.
So at the same day they released the schedule for the anesthesiology practicals also like first batch September 3rd. So we prepared like that we can be September 3rd, but our batch is on September 23rd.
Hmm.
So it also some left favor at that time because giving ample out amount of time.
Hmm.
So I started to see the ASCII videos in the our app, ma'am.
Hmm.
I finished before September 3rd. I finished ASCII and 70% of case discussion and about the drugs, that JVP, pulse, blood pressure videos also I finished it in the practical session.
Okay.
So whenever we know the exam is for being on September 23rd, I again watched ASCII videos once again,
Okay.
just before 5 days again, and remaining case discussion videos.
Okay.
Because I felt what is the being very good at the e-conceptual is the way the legendary faculty. What I felt, so many legendary faculty. I have some honorary mentions. I saw very little videos for before theory exam, ma'am, because I taken this time last year ago by Diwali time. I know about this app through Instagram. I installed and through the interface and the most appreciable feature which only eConceptual offers is the books, the 7 books which are
Yes.
good for many of them. I
Okay.
think those helped my theory. I used the only master solutions is the only source for my theory exam, ma'am. I didn't read any exams.
Okay.
I got 245 out of 400,
Wow.
700.
Hmm.
Yes, ma'am. The, and yes, ma'am. That's it, ma'am.
So you use the books for your theory exam, and then for your practical exam, you watch the videos, the OSCE
Yes, ma'am.
videos, and also the practical videos, JVP, Pulse, all that. Also, the basics that MBBS students do actually, we have
Yes, ma'am.
covered in that.
Yes, ma'am.
Yes,
Because
and
you already mentioned, ma'am, sometimes examiners will get bored of some important questions, so they will get into basics. So I watched it.
yes,
Yes,
absolutely.
ma'am.
That
Uh,
happened to me in my exam because the examiner was bored of asking normal anesthesia questions, so he went on the very basics which MBBS
mm,
students should know.
yes, ma'am.
Hmm. And
Mm.
what about your long case and short case preparation?
My lung case is it's actually chronic liver disease with diabetes mellitus posted for lower limb debridement, ma'am.
Okay.
They went more about diabetes mellitus.
Okay.
What I read in that long cases book and short cases book, that macrovascular complication, microvasculation, they expected me more about that
Yes.
point. I said well, ma'am, at that time.
Okay.
And another case is 80 years male posted for TKR.
Okay.
My another long is they asked about more geriatric age, physiological changes. What are the blocks or what are the options for this surgery for this patient?
Hmm.
They
For
they ask
analgesia post TKR.
post-op also. They also ask very basic questions, ma'am, like what is the dose of the bupropion you are using normally in that vial?
Okay.
How much the volume will be there? How much mg per ml? Is
Okay.
it a hyperbaric, isobaric? some examiners is like that, ma'am.
They
They
want to
are,
see your presence of mind.
yes, ma'am. They ask like, is this a guy is really going to OT or like that? Some like they asked
Hmm.
some questions.
Okay.
At the time, I am thinking, why these are really questions or is there different answers like that? I say, thought 1 second.
So, having some sources, good sources of preparation, did you feel confident going into the exam, or you were feeling unprepared, very nervous?
No, ma'am. I prepared well, ma'am. I think because that extra time I use very much.
Hmm.
Before that, we used to go target conference in Hyderabad, ma'am. Actually, I am from Khammam.
Okay.
Target conference by ISA people in Hyderabad. Then
Hmm.
just before, I think August 31st or 30, that date it conducted. That
Hmm.
was clearly on practicals, ma'am. It also helped me very well
Okay.
because they will directly teach the case discussion will be ongoing live and they will directly ask the Viva questions like start cases and that Viva like ABGs, ECGs,
Correct.
start cases. That also helped me a lot, ma'am.
Okay.
They cleared my mind actually, sir. We are very afraid, sir, because exam is tough. Another center, different center.
Hmm.
We don't
True,
know
sir.
anything. It's like that. Don't be afraid because no one, no examiners wants to fail you. Just
Correct.
you, just you tell what you know.
Hmm.
If you be will be silent, they think you don't know anything. Speak,
Yes,
speak
absolutely.
something, speak something. What you know, like that, they given confidence from that also helped me.
Okay.
Mm.
That is very nice. I think I should also have this one motivation session before every exam because
Yes,
that
ma'am.
really helps.
Yes, ma'am. I regularly watch ma'am, your
Hmm.
classes. Even though YouTube also, I watch your motivation. So like that first, how to prepare for PG, anesthesia PG, first year, second
Hmm.
year, third year, what you tell them. Actually, I am unable to follow that, but something I followed.
No, at least even if you can do 50%, because everyone's
Uh,
residency is very different.
yes,
Some
ma'am.
residencies are very hectic, some are little
Yes, ma'am.
chill. So whoever
Mm.
has time can follow it to the T. But even if you follow 50% of it, it's good enough. At least
Yes.
you are doing some reading during your residency, not cluttering everything for the end, those last 3 months of preparation.
Yes, ma'am. Actually, reading books and the standard books is very difficult for me, ma'am. At that time,
Hmm.
eConceptual is very helpful me because the teaching and at my time PG preparation also we used narrow platforms like we are listening and seeing. At the becoming that habit, we used to like that only. So
Correct.
eConceptual, very basics like anatomy, physiology of every system I watch from eConceptual first
Hmm.
before reading any books because
Hmm.
some books language is different or some there
Yeah,
is a standard language. It will be difficult to remember or to understand or we read only 1 or 2 pages.
correct.
But by seeing the video, almost 90% of the I mean the summary of the that system we can learn from the this app, ma'am. That is very good for any student. That the feature they provide in this app, ma'am.
Okay.
Hmm.
And one thing I want to ask you is now we have so many books. We have the DNB Master Solutions, which you used for your theory preparation. Then we have the long cases, short cases books. We have books on drugs. We have books on instruments. All this can be used for practical. Is there something that you would like to recommend us to add to this set of books so that it becomes helpful?
Yes, ma'am. Actually, almost covered, ma'am. About ASCII, there is only videos, ma'am. There is no book. There is no written format in it, I
So you
think.
would like us to add,
Uh,
yeah, a written book on OSCEs.
yes,
Yes.
ma'am. Yes,
Okay.
because almost everyone is new to ASCII, they fumble. In the app, there is a videos what is about app, and
Correct.
yes, ma'am. There is a one sir. I mean. Anmesh sir,
Unmesh, sir, yeah.
yes, yes, sir. Neuro anesthesia anesthesia. He clearly explained what will be there, how much time will be there. Like that, he
Yes.
very clearly explained. I went to neuro anesthesia, but it will be helpful for if it will be in the books also. It will be helpful, ma'am.
Correct.
Because generally for practical there will be less amount of time. I think.
Yes. And
Uh,
anything from theory point of view you think we need to add in the books?
Books, it's like almost perfect, ma'am. I think because I studied only master solutions, ma'am. I write twice.
Hmm.
I read twice, and that what are the you given images? It's very helpful, man. Because I draw very whatever I almost I got 80% of answers from 80 from master solutions. The
Hmm.
question paper also this time somewhat nice than previous.
Okay.
So, and almost that exit procedure diagrams and simulation diagrams, they are
Correct.
simple, but I used to draw it in exam, ma'am, because they
Okay.
helped me a lot, I think.
Okay.
And it will be easy to remember the topic by seeing that image also.
Okay.
That images are very nice, ma'am. And
Anything you would like us to add in regional anesthesia or
ma'am,
in the form of books?
yes, ma'am. In the master solutions for books, for the same topic, 1 year you given some answer, and another year you upgraded or the matrix
Yeah, we've
somewhat,
updated it.
yes, ma'am, somewhat different.
Yeah.
Yes, ma'am. Maybe you can give most
Similar
important,
one. Yeah.
similar one, and you can
Points.
give a book like most important repeated topics like that only, ma'am.
Correct, correct.
Yes,
Yes. We are
yes.
actually in the process of that into segregating the most important topics.
Topics, yes, ma'am.
Yeah, and printing
Yeah.
the notes of the same because I think notes is
Uh,
something that everyone wants.
yes, ma'am. That recent
Mm.
updates also very nice, ma'am. That we
Yes.
got Remima Jolam in that. That also.
Yes.
Very nice, ma'am. That also. Yeah.
Okay. Any parting words for your juniors that you would like to give them?
Junior. I
Any
don't
thoughts
think.
on how they can navigate this period?
I don't know, ma'am. I got this marks. Those are good or not because so many got good marks also. So, so I think study well. If you are if are affordable, please take eConceptual. It will be really helpful, and those books are boon for many of them, I think.
Hmm.
Because even my colleagues also they use my books. I can't
Okay.
I can't give because they shared my books. They also felt very helpful. They told also like these books are very helpful because for theory there are multiple online sources, ma'am. But
Correct.
only printable books are I think only from e-conceptual only, and
Yes.
with good images, good side headings, and with color printing, everything,
Hmm.
the color coding used for headings also very everything is catchy and it imparts memory in our brains, ma'am. That is very helpful.
Aesthetic.
Yes, ma'am. I think without books, I sometimes think without books, what we can do like that.
Correct. That's true. Even though the videos are helpful, the
Mm.
books are actually what you will keep revising again and again.
Yes, ma'am. Uh, yes, ma'am.
All right. Thank you very much. And all the very best. If you're planning to give super specialty exams, we also have a section on that in the app. So you
Yes,
can
ma'am.
do the SS recall question bank, which we have
Yes,
added newly. And we
yes,
are
ma'am.
also in the process of adding a new question bank with video solutions.
Okay.
So
Okay.
do go through that if you're giving SS.
Okay, ma'am. Please make a my request, ma'am. Please make a video for specially passed out students about another options to explore.
Oh, yes, definitely.
Like someone
Pain.
going to fellowships, someone to
Fellowship,
do
yes.
super
Yes.
specialty, someone to go into set into government. Because for DNBs, it's not easy to get SRship.
Correct,
So,
yes.
and we don't have adequate knowledge about how can we get SRship or is a SRship in private or government is eligible for getting into medical college as assistant professor. We don't have clarity also, ma'am.
Yes, okay.
And regarding different fellowships available,
Fellowships, yes.
please do, ma'am.
All
It
right.
is our sincere request.
Definitely.
Uh,
Thank you. And this is your time to shine and enjoy. All the very best, Chaitanya.
okay, okay, ma'am.
Congratulations.
Thank you, ma'am. I want to thank my department. Thank you, ma'am, because they very cooperated, especially my HOD sir by giving adequate word of. He very encouraged to study because
Okay.
he first recognized DNB is very difficult. It's not easy. What do you think? He forced us. He encouraged to first study. You will once you pass the exam, you will be do the cases. That's not first getting degrees important. Like that, he encouraged very, ma'am, thanks to our HOD sir and our department. They also very cooperated, my juniors, by adjusting duties.
I think you are a very nice person. You're thanking everyone except yourself. But you have also worked hard, so you
Uh,
should thank yourself also.
yes, ma'am, but because our surrounding environment also will be good, ma'am, for to do something like that. And
Yes.
especially my family members, my wife, who give motivation. And I'm very exam stressed person, ma'am. At that time, she stood by side.
Wow,
And
that is
my
the best thing.
uh,
It really helps when you have a partner, especially
uh,
during this
uh,
exam phase. I know even I've been through it, and
yes, ma'am.
one person will calm you down all the time, even though
Yes,
you're
ma'am.
very worked up.
Yes, ma'am. And lastly, my parents and my mother-in-law who take care of my baby at the during exam time.
Oh, congratulations! You have a small
Yes,
baby.
it's my 1 year old male baby, boy.
Okay, I know how difficult that must be. You must be feeling like going and playing with him, but you have to sit here and study.
Yes, ma'am. Because for somewhat it will be easy for us, ma'am. I mean, being a male or anesthesiologist, my wife who is doing DNB OBG in a hectic,
Oh,
very good institute, she got also very good marks, ma'am, 265 out of 400,
wow, very good.
more than me. I want to cross her marks, but I didn't.
But girls are always doing better than boys
Uh,
only.
yes, ma'am. They are, I mean, multi-talented.
Multi-talented. Yeah.
Multi-talented. Yes, ma'am.
Okay. Convey my regards to your wife also,
Okay,
and as
ma'am.
well as your in-laws.
Mm.
And heartiest congratulations and all the very best.
Thank you, ma'am. Thank you, ma'am.
Thank you.
Once again, it's very honor to meet you, ma'am. Thank you.
Thank you.
And I want to mention some legendary faculty, ma'am, which
Yes, please, please.
their teachings are very helpful. Govind
Right.
Rai Garg, sir. Their
Performer.
yes, ma'am. Your collaboration with sir for pharmacology techniques, all induction agents. I
Hmm.
saw already individual drugs videos, but at the practical time, those videos are very helpful, ma'am. That
Hmm.
mnemonics are given,
Hmm.
sevoflurane for halothane,
Correct.
and another drugs are very very helpful, and they can be easily memorable, ma'am. That very very nice, ma'am. And Unmesh sir, neuro is very nice. Neuro
Hmm.
is Indrani ma'am, optic cameras, topics like that. They are also
Hmm.
very helpful, ma'am.
Hmm.
And another very admirable ma'am after you is Guru Santia ma'am. Ma'am teachings
Ah,
are very nice, ma'am. Like optic drugs, our case discussions,
yes.
very elaborative. And drugs in optics also very explained, very nice, ma'am. And Gargi Deshpande, ma'am,
Hmm.
like cardiac OSCE,
Hmm.
hypertension classes, very nice, ma'am. So,
Hmm.
ma'am, also. And Saurabh Taneja, sir, traumatic brain injury classes, ABG, ventilatory graphics.
Hmm.
Like before theory, I used to whatever seminar I given in the department, whatever doubt I have, I just search in the app and I will see the videos, ma'am. Very
Correct.
useful to prepare a seminar or presentation also for that. And the notes you given for most of the videos also, ma'am.
Yes.
That is very nice, ma'am.
Hmm.
Mm.
Yeah, I mean, I can. That is one added bonus of the app that you can
Uh,
prepare for your seminars and your case presentations during your 3 years of residency also.
yes, ma'am.
Yes.
That DNB Master Solutions also notes also there. Whenever I traveling, I use only iPad. I brought my iPad and I will study in the iPad that notes only. That was very helpful, ma'am.
Correct.
Mm. Yes, ma'am.
Correct. Okay. Thank you very much.
Okay, ma'am. Thank you.